Public Information Officer for the City of Albany's PIO team. Thank you for joining us this morning for this press briefing with updates on COVID-19. As of this morning, we have lost over 170 citizens in our community. Please join me in a moment of silence for the lives we have lost and for the families they have left behind. Thank you. Now we'll start off with Dougherty County Commission Chair, Christopher Cohilas.
Thank you, Phyllis. Good morning, everyone. Today I'm going to be rather brief in my delivery of the message today. Right now, we're in nearly the same place we were about a week ago. There hasn't been a tremendous change in our circumstances. We're continuing to see the same trend over and over again. We've seen, as we've described, initially we had such a tremendous onslaught of the virus within our community that we had this enormous spike that happened, and we were all reeling to catch our breath and trying to respond and trying to establish policies and cultures and ways of dealing with this in our community that were able to bring that spike back down. And now we've gone back to a more normal, but not the same normal that we used to have. This is our new normal. And so, as expected, we are continuing to see an uptick from that valley that came after the initial spike of the virus, and we're back around here. But what's good and what's promising to me, that I'm very encouraged by, is we continue to see that our death rate is not spiking. We are protecting the people that we need to protect. We are still losing some people, and that is absolutely a tragedy. But in terms of where we are as a community and compared to other communities around the state, we're doing a very, very good job because our citizens are working with us for the most part. Largely, our citizens are doing a great job of masking up, of social distancing, of sanitizing their hands, making sure that we're doing all the things that we need to do. And I want to say thank you to the citizens of Dougherty County for doing that. And I want to talk about this in terms of real numbers. If we could get this clicked. We were working earlier. Well, we'll come back to that slide. Mr. Good, if you could get us to the slide with the pie graph, that would be great. There we go. So we're currently trending, we're testing a tremendous number of people in this community. The Department of Public Health, Phoebe, and many other partners have had to come together to put together the level of testing that we have in this community. And I really cannot stress enough how important that has been in terms of us being able to gather a picture of where we are at in terms of our progress. Other communities have not tested like this, and as was reported to us about 6 weeks ago, at least at that time, we knew that we were the most heavily tested region in the entire state. Right now, as the graph demonstrates, we're currently hovering at about 13% of the people that are being tested that are testing positive. That's around the same area, perhaps a little bit lower than we were about a week ago, but it's all relative. What's good to know is that we're not experiencing these meteoric spikes, and those are the things that we don't want to see. How do we continue to maintain this? And we continue to do the same things that we've always been doing. And I also want to stress some other things as well. We're coming up on flu season, and I think with this virus and the way that it has gripped our attention and gripped the medical field's attention, gripped people's attention, their fears and the worst things that they could imagine, many of us are not thinking about the other things that we need to take care of in terms of our personal health care. I've heard again and again and again that there's been a large number worldwide, and I think that's important for us to remember. We're not experiencing this alone, but worldwide and across the country, I've heard these numbers about the number of cancer diagnoses that have gone way down, and The cure to this virus cannot be worse than the disease itself. And we have to make sure that while we're using all appropriate care, that we continue to take care of ourselves, that we continue to access health care in a reasonable and diligent fashion. We have flu season coming upon us, and it's important that we go ahead and get vaccinations for the flu, so that we're not neglecting the other areas of our lives that continue to exist irrespective of whether or not we're in the middle of a pandemic. Again, I'm going to be very brief today. I continue to be very thankful for the progress that we've made. We're currently plateauing in this sort of second curve or second spike. It appears to be maintaining a positive trend, which is encouraging to me. Lord knows I would much rather not have to have any press conferences at all, and that we wouldn't have to have any sort of response to the pandemic. But I think it's important that we let people know we're doing a good job. And I want to thank all of our citizens. I want to thank our tremendous medical staff. I want to thank the coroner. I want to thank public safety. I want to thank the Department of Public Health, all the members of the Emergency Management Agency, the members of the city staff, the county staff, and otherwise that have worked to make sure that we have been able to get to where we're at today. And I also want to remind everyone that we will have an announcement probably within the next 2 weeks regarding antibody testing that we will be deploying here in the community. That's a very big deal. We are finalizing the final stages of what that's going to look like in partnership with Augusta University, that has also partnered with the governor's office in the state of Georgia to provide high-end testing to help us assess our progress in this pandemic. Thank you.
Thank you, Chairman Cohilas. Now we'll hear from Dr. Stephen Kitchen, Chief Medical Officer with Phoebe Putney Memorial Hospital.
Thank you, and I'll go ahead and provide our update today. And I think similar to the comments that you heard from Chairman Cohilas, what I will tell you is what we're observing over the last several weeks is, although we certainly began seeing an upward trend in terms of the number of COVID positive patients that have been, that require hospitalization over the last several weeks, it seems to be relatively stable and without any significant changes compared to last week. Our numbers for this week look very, very similar to those that we saw last week. And so I think what we're observing at this point is that, we all appreciate the tremendous spike of COVID positive cases that we had in our community. We were absolutely besieged and truly overextended throughout the month of March and throughout the month of April. Fortunately, we saw a dramatic decline throughout the month of May and probably through the early part of June. We hit that first plateau, which we maintained really through the month of June, began noticing an upward tick in the month of July. And I think what we're currently observing now is that we have a new plateau. And that's what we have observed across the Phoebe Health system for the last several weeks. So I will tell you what our numbers are today. We currently have 70 patients that are admitted with COVID-19 across our health system. 55 of those are at Phoebe Main and Phoebe North here in Albany, 13 at Phoebe Sumter in Americus, and 2 at Phoebe Worth. So that 70 compares to 67 at this time last week. And so again, what I want to convey is, although we are certainly seeing COVID transmission in our community, and a certain percentage of those persons are requiring admission to the hospital, it looks relatively stable at this week. And so we see some variation from day to day, depending on the number of new admissions with COVID-19 and compared to the number of patients who are discharged each day. And so we'll see some fluctuation on a day-to-day basis, but again, I just don't think there's really been any significant change this week compared to last week. Unfortunately, we have had a total of 161 patients that have expired, that have died across our 3 hospitals in the health system. That 161 compares to 156 last week. So there have been 5 patients that have died over the last week. I know, I think with the exception of 1, all of those patients had a prolonged stay within our intensive care units, and unfortunately that is just that's the manifestations of this virus that we're seeing at this time. That's certainly a much lower number than we were observing in the month of March and April. And what I will tell you is our understanding of the biology and what we call the pathophysiology of this disease and how we can best manage it from a medical standpoint continues to evolve. I again want to applaud all of our clinicians, the doctors, the nurses, respiratory therapists, and all the people behind the scenes that work to provide the clinical care, and that our ability to manage the various manifestations of COVID-19 continues to evolve and continues to improve. But I do want to emphasize the fact it has the potential to be a very serious and life-threatening infection. I don't really have a whole lot to add over and beyond that, but appreciate all the great coordination that we have through the state, the federal government, and all our local agencies here, such as the Department of Public Health and our Department of Emergency Management. So thank you again.
Thank you, Dr. Kitchen. Now we'll hear from Public Health. From the Director of the Southwest Georgia District of the Department of Health, Dr. Charles Ruiz.
Good morning. Testing for COVID-19 remains a very important part of our response. It helps us to know which individuals are infected with COVID-19. It gives us an idea of where the community is in general. We have a 14-county health district, and throughout the 14 counties, public health has collected a lot of samples to send off for testing. As of noon today, we will have reached the 40,000 mark as far as our testing, and we will continue to test. We are completely prepared to test through the end of the year and beyond if necessary. We don't anticipate any pullback anytime soon. Getting a test is easy to do. And there are some particular groups of folks that we stress the need for testing, particularly those who have symptoms that are consistent with COVID. We'd like for you to get a test as soon as you can and stay home, at least until you know the outcome of the test. If you have been exposed to COVID-19, we also would like for you to be tested. Let me be clear about that, though. If you've been exposed to COVID-19, then you would be asked to quarantine yourself at home for 14 days beyond the most recent exposure. If you test while you're on quarantine, we hope that test will be negative, but you should not and cannot come off quarantine just because you have a negative test. You see, the purpose of quarantining is to separate people who have been exposed and watch them throughout the incubation period to ensure that they don't become sick. So the incubation period goes up to 14 days. So no amount of testing that we do would relieve our responsibility to wait for those 14 days. But if you get tested after being exposed, then it helps us to determine as soon as possible if you're going to be sick, then we've got to figure out who might have been exposed to you. So just to make that clear, we do want you to get tested if you are on quarantine, but a negative test does not mean that the quarantine comes to an end. And I'd like to say again that there's one group of people who we really don't want to get tested, and that's those folks who have already been tested and been found to be positive, and they are now over their COVID isolation period. We do not recommend that those folks get tested again. It will not give us any meaningful information, except in very rare cases. So if a physician recommends that you get tested a second time, we are going to honor that. But otherwise, it is not necessary to get tested. For people who have been infected with COVID, the vast majority of people can come off of isolation in 10 days. A small group needs to wait 20 days, particularly those who have been hospitalized and those who have severe compromise of their immune system. But even then, it's not necessary to test again. Some employers continue to require that their employees get tested after they have recovered from COVID. And this is really inappropriate, and it actually is wasteful because we have a limited amount of resources and we want to use them wisely. So getting a test is easy. We would prefer that you make an appointment if you're going to be tested through public health. Making an appointment makes it go faster for everybody. It helps us to know how many supplies that we need for test days. Well, so for those of you who can see our slide, we're showing the 9 different locations. We also, the 9 different counties where you can get tested. You can call to make an appointment Monday through Saturday. The number is 229-352-6567. Another good way to make an appointment is to go online, and you can do that 24 hours a day. The website is covid19.dph.ga.gov. And you can go there, you can see the locations that we have available, and you can see the appointments that we have available, and you can choose one that works for you. So for people who were tested back in March, April, and May, they probably have memories that are not so pleasant. Back in those days, when we were swabbing patients, we were using a device that required that the swab go straight back into the nasal passageways about 3 or 4 inches. And I had that done, and I know that it's not particularly pleasant. Things have evolved a little bit, and we are now exclusively using the nasal swab method. And the nasal swab only goes 3/4 of an inch back into the cavity. And I want to demonstrate that for you. It's easy to do. 3/4 of an inch is the diameter of a penny. So that's not very far, and it's not really unpleasant. Furthermore, what we're asking people to do when they come through the line is to swab themselves. And the reason for this is it helps us to cut down on the use of personal protection equipment. And again, that's a limited commodity. So anytime we can save that, that's a good thing for the community in general. Also, it means that we don't have to have as many licensed clinical personnel on the site, and it frees them up to take care of the normal and routine business of the health department. So for people who are able, we're asking them to swab themselves, and we recognize that little children can't do this, and people with neurological conditions and so forth aren't able, and we will perform the swab in those cases. But if you can swab yourself, it will certainly help us. And I want to remove my mask so that I can show you how simple and easy this is. When you come through the line, we're going to hand you a little packet that has a swab in it and a test tube. And so what we'll do is we'll ask you to use this one swab on both sides of your nose, one at a time, of course. So we'll ask you to insert it about 3/4 of an inch. You'll twist it a couple of times. You'll hold it for 15 seconds, remove the swab, insert it on the opposite side, and repeat that same process. So I've got my test tube open, I've got my swab, and in it goes on the right side about 3/4 of an inch. I rotate it a couple of times and hold it for about 15 seconds. When 15 seconds are up, I remove it. It goes in the left side, rotate it a couple of times, hold it for 15 seconds. It comes out of the nose, it goes directly into a test tube. There's a mark on the swab that usually breaks off real easily, and wouldn't you know, I'm having a little bit of difficulty. But there it goes. Put the top on the test tube, and then you would hand the test tube to the nurse, and you would be driving off, and this test tube would be carefully handled and would be sent to a reference lab. Generally, we get the results back now within 48 hours, and in some cases even less than 48 hours. So the testing is easy to make an appointment for. It's easy to do. It's quick, particularly if everyone makes an appointment. You will get the results back in a reasonable amount of time. You also have the option of going online to find your results, even before the health department calls you, and you will be called about your results if you are positive. So I want to remind you again that sick people need to stay home. If you've got any of the symptoms that are consistent with COVID-19, you need to stay home and you need to get tested. And at this time of the year, I think it's very important that we emphasize that this rule of thumb definitely extends to school children. I know some school districts are doing online learning, but many are doing face-to-face learning. And it's very important for parents to check on their children before they send them off to school. I was talking with a teacher just a few days ago in a system where they are back in class, and she mentioned that there was one car that pulled up and had 3 children inside, and they all had elevated temperatures. So please check on your kids before you send them. If they're showing signs of sickness, don't send them to school. They very well may have COVID, and they may transmit it to a lot of other children while they're there. But we remain in a dangerous pandemic. COVID-19 is still with us. People are still getting sick. People are still getting hospitalized, and people are still dying. We need to do our part to keep ourselves healthy and to keep our community healthy. Remember to wear a mask when you're out in public. Stay at home if you're sick. Wash your hands frequently. Disinfect hard surfaces. And if we'll all do our part, there's a good chance that we'll be able to control this virus. And if we can do that until the vaccine arrives, we're going to be in good shape. Thank you very much.
Thank you, Dr. Ruiz. Now for our final speaker, Dougherty County Coroner, Mr. Michael Fowler.
Good morning. We have some good news. We have some bad news. At this present time, we had 173 positive residents in Dougherty County that have died from the virus. Since the last update, we've had 3 additional females that make it 102 deaths, and we have 1 male that have died. The good news is that they are not dying like they was at first. That's the positive news. but I still feel that one death is still too many. So we have 102 females. Last week we had 99, so we up 3, so that's 102. Last week we had 70 males, now we at 7 to 1. We have 34 whites last week, now we have 35, we have 1 more. And blacks we would like to say we up 3 more, so we at 137 now. We still at 10 white males. We got 1 white female, so we at 26. We still have 1 Latino. We have 61 black males. We had 60 last week. And now we up 2 more black females, so we have a total of 75. And the age range is the 70s and 80s. Those are the deaths that we've been having for the last couple of weeks. And you see the trend back in the first of June, but nothing compared to what we was in March and April. But in June, the first week we had 1 death, the second week we had 1, and it jumped up June the 14th to 3. Now June the 21st through the 27th we had 0 deaths. The 28th through the 4th of July, getting ready to come from the holidays, we had 1 death, but after the 4th of July we jumped up to 4. Then we dropped back down to 2. July the 19th through the 25th, we went up to 4 again. July the 26th through August the 1st, we had 2 deaths. August the 2nd through the 8th, we had 2. And off this week, we just had 1 death. But like I said, the bad news back then in March, April, we was having 39 deaths in March, 86 in April. May we had 26. June, we dropped down to 6. After the 4th of July, in July we went up to 11, and as of August we have 5. So the good news, we're nothing compared to what we was back in March and April, but still, like I said, 1 death is still too many. So I want to encourage family and friends, mask up. That's going to be the safest thing to do. And many times I'm on the street and at the stores or whatever, different ones say, what we think we ought to do, mask up. Everybody needs to mask up. I don't need the government, I don't need the mayor, I don't need the commissioner trying to tell me to put a mask on. I need to do that for myself. So this is going to be one of the most positive things that you can do. If everyone masks up for the next couple of weeks or 2 or 3 weeks, I think we'll do ourselves a favor by trying to save lives. Like I said, it could be your life next, it could be one of your loved ones. So I encourage you to mask up. Thank you.
Thank you, Mr. Fowler. Now, we'll open up the floor for questions. Seeing that we have no questions, a simple reminder, the Emergency Operations Center remains open from 8 a.m. to 5 p.m. daily. If you have any questions, do not hesitate to call us at 229-302-1900. Don't forget to join us next Friday, same place at 10 a.m. We'll see you then. And also remember, mask up Albany, mask up Dougherty County, and it only takes 10 minutes to fill out your census form. Have a great day.